Medicare Supplement Plan G replaced Plan F as the most popular plan in America. So any of your friends that are older than you probably have a Plan F. In January 1st of 2020, nobody new could get a Plan F. It kind of got grandfathered by the Obama administration. So you have a lot of friends that might have an F. You can't buy an F. Is that a bad thing? Not necessarily. Plan G is cheaper than a Plan F, even when you factor in that Plan G has an annual deductible, which Plan F didn't. The annual deductible for 2022 is under $300. It's $233. You pay that one time, and that will go up every year. So it went up $30 this year. It will go up every year for the rest of your life. Plan G is considered the Cadillac plan, which means all you pay is your monthly premium, that one-time deductible, and you don't pay anything else. You don't pay extra to see a doctor, to go to a different hospital, to see a specialist. You don't pay extra for anything. It covers everything as long as you continue to pay your monthly premium and that one-time deductible. So why doesn't everybody buy a Plan G? Because Plan G is more expensive than a Plan N. Plan G is the most popular because at 65, it's not very expensive. And you're like, this is a good deal. But as it goes up every year, and it depends on what company you buy it from, that it will go up between 5 and 10% a year. So after about 3 or 4 or 5 years, a lot of people are looking for other avenues because it's become so expensive and it's pinching their budget. So that's one of the things we do with the Medicare family is we try to help you navigate this, not just today, but for the rest of your life, because Medicare is your health insurance for the rest of your life. Plan G is a great starting point because it doesn't have any of the hassles that other plans have with the co-pays and the restrictions on networks. You can travel all over the country, go to any doctor and any hospital in the country. So it's a great plan for people that have kids that live in a bunch of different states, or that they're snowbirds and they live part of the time, or the people that are traveling around the country all the time. It is the premier plan for people that travel around the country and for people that can afford it. So if budget is not an issue, I always recommend a Plan G. And like I said, at age 65, when you're first aging into Medicare, it's not very expensive, but it will go up every year, regardless of your health, regardless of how much you use it. They can't raise it because you had a heart attack. They will raise the whole plan on everybody that has that plan. So one of the things we do with the Medicare family is try to chase rates and benefits. So if you're healthy, we might take you from Plan G with one company to a Plan G with another company. You get the exact same benefit, but we might be able to get you a lower price as you go down the road. To do that, in most states, you have to be able to answer the health questions. So that's where our research will come in. Some states you're able to change every year around your birthday or around the anniversary of your policy. And I think there's about 7, 8 states that give you that right. The majority of the country, you can only change a Plan G to another Medicare Supplement plan if you can answer the health questions. So while you're healthy, that's one of the things we do. We try to help you maximize your benefits and your price. Plan G, again, is the Cadillac plan. If money's not an issue, that's the plan we want for you. And if money is an issue, we have a lot of other plans that we can try to fit into your budget. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.